Hello, guys. We are going to look at another topic in medical surgical nursing, assessment of patient with urinary tract disorder or urinary system disorder. The first one is health history. The health history. The history of the patient is very important in assessing the urinary system disorder. This history includes the color, odor, and amount of urine, the history of difficulty in initiating urination or changes in force of urine flow, the history of normal pattern of urination and recent changes from usual pattern. What is the normal pattern? How many times is a person always urinating? And the difficulty in initiating urination, the flow of the urine. Is a person having a free flow of the urine or the urine stop in between the flow? Usual type and amount of fluid intake. What fluid? When the patient takes too much fluid, there is high tendency of passing high amount of urine. Painful urination. Is he having dysuria? Nocturia. Does he or she urinate more than one time at night? Does he pass blood? You ask history. Does he pass blood with pass urine with blood? That's hematuria. Or is he passing urine with that is cloudy or smelly urine? The abdominal, is he having abdominal or suprapubic or flank pain? Inquire about the onset. When did the urine start? The urinary tract infection start? The duration, how long has it been? The severity, is the disease mild? Is it moderate or severe? If pain is present, ask patient about specific location and nature of pain. Is the pain sharp? Is the pain a burning or dull? Is the pain constant, stabbing, or intermittent, as well as intensity? Ask patient about previous urinary tract infection or surgeries. Determine the medication that the client is taking. Ask about chronic disease such as diabetes, heart failure, kidney failure. Determine the family history of kidney disease, kidney failure, and kidney stone. The physical examination. The patient can be assessed with physical examination. Example, inspection. Inspect the patient urine for odor, color, and clarity. Inspect the genital area or urinary meatus for redness, swelling, discharge, or ulceration. Expose the abdomen and observe for contour and symmetry. Is the abdomen symmetrical or asymmetric? Is one part bigger than the other? Auscultate the Boyle sound. For Boyle sound, lightly palpate the abdomen for tenderness, including suprapubic region. Percuss the kidney for tenderness with client in sitting position and the back exposed. The diagnostic tests. This include laboratory tests. Lab tests such as urine studies or urinalysis is very important. Urine microscopic culture and sensitivity tests, blood tests such as blood microscopy, culture and sensitivity, electrolyte sedimentation rate, full blood count. The imaging studies is also very important. This include X-ray, CT scan, magnetic resonance imaging, ultrasound imaging, and so on. And voiding studies. Voiding studies is very important. This is used to evaluate voiding and lower urinary tract function, urinary retention, and urinary incontinence. The uroflowmetry is a non-invasive test. It's not painful. That measures the volume and rate of urine flow. Before the test, the client is asked to drink plenty water or fluid and avoid urination for several hours after voiding. The client is placed in a special bathroom and advised to avoid dropping tissues into the funnel or collection container. Privacy is provided and the clients void into the urinometer funnel without straining. Thank you for listening. This is the assessment of patient with urinary tract infection. This assessment is applicable for all urinary tract infection. The history taken, lab investigation, X-ray, and uroflowmetry is very important in the assessment. The assessment is applicable for all urinary tract infectious disease, such as pyelonephritis, glomerulonephritis, kidney stone, and so on. They are all applicable. This is the general assessment. Thank you for listening. You may ask any question, comment, subscribe, and share. Bye.